Good morning. Thank you for the opportunity to be here with you. I'd like to thank the Berkley Center and Tom Farr and Michael Kessler and Timothy Shaw and others who I've had the privilege of working with over the years. I also want to say how much I'm glad to be on this particular panel of distinguished advocates and scholars. And as I look around the room, I just have to notice that we could make probably 20 excellent panels out of those gathered here today, because I see so many of you who have worked on these issues and are experts yourself. So this has the makings of an excellent event and discussion, and I'm just grateful that you're here and look forward to that discussion. Because our time is really short, in this particular segment, I'm just going to focus on the issue of religious organizations in the employment context and try to touch on two important principles here. Professor McConnell has already talked about one of them in some depth, which is honoring the objections of religious organizations to paying for or providing contraceptive services. And the second principle that I'd like to discuss is the court has told the government that when it does make religious accommodations, it has to be attentive to the impact of those accommodations on non-beneficiaries of the accommodations. In this case, that would include women working for objecting religious employers. So let me start with the first principle. In my view, if the federal government forces religious organizations to pay for or provide contraceptive coverage when they object to contraception, it would be not only bad public policy, but would, as Professor McConnell explained, create violations of the Federal Religious Freedom Restoration Act. As he said, that act, and I know many of you here work to get it passed, and it says that the government cannot place a substantial burden on religious exercise unless it has a compelling interest for doing so and is using the least restrictive means, the means that are least restrictive of religious exercise. And this, as was mentioned, is a very tough standard, and properly so, I think, because religious exercise and the ability to practice our faith as we see fit rather than as government sees fit is a fundamental human right. It received greater protection in years past from the Supreme Court, but thankfully now it is protected through a federal statute when the Supreme Court has been less protective of that right. So in this case, as I said, I do believe that it substantially burdens the religious exercise of an organization if it objects to contraceptive services and thus to providing insurance for contraceptive services. And if the government were to force that organization to do so, it would create a substantial burden. And even assuming that there is a compelling state interest in this case in expanding contraceptive coverage as widely as possible, I don't think that would be the least restrictive means of promoting that compelling interest, in that there could be other entities or independent of the religious organization that could provide that coverage rather than having to force the religious organization to do so. Even if this, however, act did not cause what some would consider to be a RFRA violation, and that's the shorthand that I'll use for that statute, RFRA, I think that the government does well when it seeks to accommodate burdens that might fall short of substantial burdens, generally speaking. The government cannot and should not grant every accommodation of free exercise rights or the ones that fall short of substantial burdens, but we do have a great tradition in America of the government trying to do whatever it can to ensure that religious communities can practice their faith as they see fit rather than as government sees fit. So for these reasons, my view was that the original mandate with its very narrow exemption was deficient, both because it would have likely created violations of RFRA and because it was vulnerable to First Amendment challenge. I won't belabor all of my concerns here, but I think the exemption was faulty in part because it was too narrow and took issue with the way that the exemption is framed in terms of factors like an organization that primarily serves, an organization that would only be a religious employer if it primarily serves people of its own faith. That is not a good or correct understanding of religious exercise, and so I objected along with many others for that reason. In response to those objections, the administration has announced a revision in its policy. As you know, that policy is still developing, but I certainly welcome the administration's course correction, and I believe that it is an important course correction. So I think that it is not appropriate to dismiss that course correction as unimportant. The administration, unfortunately, has not changed the exemption, despite requests that I've made and others have made to change that exemption, but it has created or proposed a policy that would have the practical effect of broadening that exemption by ensuring that religious entities that are not covered by the exemption, like religious hospitals, social service agencies, and schools and universities, would not have to pay for or provide this objectionable insurance. So I think that the administration has not fixed all the problems, but it has made some important strides. The rulemaking is ongoing and provides opportunities to press some of these issues where those who feel that their religious exercise would be burdened by this accommodation can express their views, and those views can be considered and hopefully met. I will note that while the accommodation was not acceptable to all who have objections to contraceptive coverage, it was greeted with great acceptance by certain parts of the Catholic community, and I think that's not insubstantial. We do have in America different understandings of faith. Even within the same faith tradition, we can have different understandings of faith, and I think it's important for us to remember that there were some Catholic organizations who said that this kind of accommodation would be acceptable and work well for them. The second guiding principle that I just want to talk about is that the government also has to be attentive to the effect that religious accommodations have on non-beneficiaries. And in this case, again, that would include women working for objecting religious organizations. A unanimous Supreme Court most recently in 2005 instructed the government to take this effect into account when it was fashioning accommodations for religious exercise. So we haven't heard as much about this constitutional principle, but I think it is important to bear in mind. Here we have a federal rule that extends certain benefits to most American women through their employers. And in the U.S. right now, of course, we have basically an employer-based healthcare system, for better or for worse, and I happen to think beginning to think it's more for worse than for better. But putting that to one side, we do have an employer-based healthcare system in the main. So granting an exemption to a wide array of religious entities could operate to deny those federal benefits to many women who would like to have them. Now, of course, the objectors believe that these benefits are bad or unnecessary, but many others believe that they are good and needed. And I think both views count, and it is the right thing for government to do to seek to meet the needs of both groups. I am not a healthcare expert or a social policy expert, but just because Helen lifted up some of the arguments on the other side, let me just mention a few of the arguments that those who would like to have these benefits mention. Women talk about the fact, and other experts talk about the fact that spacing outbursts improves maternal and child health and thus strengthens families. There's difference in the literature, but some experts have done studies saying that this extended contraceptive use not only reduces unintended pregnancy, but also reduces the number of abortions. And I think reducing the number of abortions has strong support in the pro-life and the pro-choice community. Are these benefits necessary? Some say no, but others say, look, some of the most effective and reliable forms of birth control are not something you can go into the drugstore and just pick up with a drink or something. They require ongoing doctor supervision and prescriptions or procedures. And so it is important to build the coverage in for those reasons. Many of these same forms of contraceptive coverage are also relatively expensive, especially for women who would not be able to get the benefits. They're of modest means, but they would not be covered, or their needs would not be met by programs like Title X and Medicaid. So here too, I think that is it important, even if these interests on the other side do not rise to the level of something that would be constitutionally or legally required, I think it is important and appropriate for the government to try to meet these needs as well without burdening the free exercise rights. So in conclusion, I'd say that I think it is appropriate, again, for the government to honor the free exercise interest here, the free exercise objections to providing this care, and also to seek to ensure that women of objecting religious employers will be able to receive these benefits that they would like to have. So thank you.